Another common condition we see in patients, typically in younger patients under the age of 45, are labral tears. Labral tears are something that usually occurs from an injury secondary to either a contact injury, like in a contact sport, where the ball pops out of the socket, or if someone falls and reaches with their hand sticking out, where the ball can subluxate or partially dislocate on the shoulder. Labral tears are more commonly seen and more commonly a problem in the younger patient population, in the athletic population, or anybody really that participates in overhead sports, overhead throwing sports, or even contact sports. We see them in football players, hockey players, lacrosse players. We see them oftentimes in baseball pitchers or throwers or tennis players, recreationally, collegiately, as well as in Little League or professionally. For our contact athletes with labral tears, oftentimes we do perform arthroscopic surgery to reattach the labral tear back to the bone or to the glenoid. The glenoid socket, which is the bone that the labrum attaches to. The reason why is that the labrum provides stability to the ball and socket joint. And with a torn labrum, patients can have continued pain, continued instability where the ball may want to pop out of the socket. Some labral tears are small, and they can oftentimes be treated with non-operative measures. Physical therapy rehabilitation oftentimes works for these patients as well. A particular kind of labral tear is one where the biceps tendon attaches to the top of the labrum, or what we call the 12 o'clock position. Those typically don't occur in patients that have instability, but rather in patients that are performing overhead sports, throwing sports, or racket sports with overhead activities. We also see these in our manual laborers who are performing repetitive overhead tasks. Oftentimes, these patients require one of two operations. These type of injuries are called slap tears, or superior labrum to anterior posterior tears, where the biceps anchor or the biceps tendon continuously pulls on that labrum.